Spina bifida is a term that comes from the Latin word split spine. It is a condition some babies may develop while in the womb. Spina bifida affects the spine and the spinal cord of the baby. Doctors are not sure what is the cause of this condition, but they do believe it can be because of genetic factors. The characteristics include bowel incontinence and urinary incontinence. Depending on the severity of the condition, a child can experience loss of skin sensation in the legs and around the bottom. Students with spina bifida may need special accommodations in the classroom, like special seating and desk. Students will show signs of learning disabilities as well as problems with memory and paying attention. There are approximately 1,400 babies born in the U.S. with spina bifida, according to the U.S. Centers of Disease Control and Prevention. It is sadly one of the most common permanently disabling birth defects. The cause is still unknown, although it is believed it is genetic and environmental factors. It is also believed that it can be caused by folate deficiency during the pregnancy. Mothers with certain conditions like diabetes and obesity are at higher risk of having a baby with this condition. Spina bifida can cause seizures and leg and foot deformities. There are 3 types of spina bifida, and these include a spina bifida occulta, meningocele, and myelomeningocele. The 3 types of the spina bifida are spina bifida occulta, the meningocele, and the myelomeningocele. The spina bifida occulta, this is when the spinal cord and the nerves are usually normal and there is no opening in the back. In this form of spina bifida, there is only small defect or gap in the small bones, which is in the vertebrae, that make up the spine. In many cases, spina bifida occulta is so mild that there is no need to disturbance the spinal. There is no disturbance, of the spinal function at all. The meningocele is the rarest type of this condition, and it occurs when the bones do not close all the way around the spinal cord. The meninges are pushed out through the opening, and it causes a sac filled with fluid. In most cases, the spinal cord and the nerves themselves are normal and are not severely affected. The sac is often covered with skin and may require surgery. The myelomeningocele is the most severe form of this condition, and this is when the spinal cord itself protrudes through the back, and in some cases sacs are covered with skin, but in other cases tissue and nerves are exposed. If the bottom of the spinal cord is involved, there may be only bowel and bladder dysfunction, while other severe cases can cause paralysis of the legs while accompanying bowel and bladder dysfunction. And the students with this condition can be in normal class settings, but they do require some speech and physical therapy, which should be provided by the school. Since this is a permanent disability, students need accommodations in the classroom. He or she may need a wheelchair to get around the school, so this is important to have a classroom that has access and is accessible for them. If the child is born with movement of the thigh muscles and feelings down below their knees, then the chances are good that they will walk, but they need some kind of brace support. Special desks and seating should be provided for the students. Children with this condition do well in school, but they do experience some difficulty paying attention. They may work slower than others. It might take a little more time for them to catch up, and they also may have trouble remembering things. And students may require an IEP, which is a document stating the assistance the child will need at school. And this type of document is created by parents, teachers, and physicians. Parents also may request a 504 plan, which is if the child is not eligible for an IEP. And that's it.